Good morning, everyone. Today, my lecture is about health education and health promotion. So let me share a PowerPoint presentation. So have you heard of the term health education? What do you mean by education, or what do you mean by health education? Okay, so the word health education comes from is derived from the Latin word educare, which means to bring out and to lead. Health education is a process of imparting information about health in such a way that the recipient is motivated to use that information for the protection of advancement of his own, his family, or his community health. So these are some of the basic definition which you already know. The first one is about health. The definition given by WHO 1948, it is a state of complete physical, mental, and social well-being, and not merely the absence of any disease or infirmity. Next is a few definitions for health education given by different persons and some agencies. So out of that, the definition what I want you to learn is given by the National Conference on Preventive Medicine in the USA. Health education is a process that informs, motivates, and helps people to adopt and maintain healthy practices and lifestyles, advocates environmental changes as needed to facilitate this goal, and conducts professional training and research to the same end. So this must be the definition. From all these definitions, it's better to memorize this definition given by National Conference on Preventive Medicine in USA. Moving on to the aims and objectives. The primary aim and objective of health education is to informing people, motivating people, guiding into action, stimulate individual and community participation. Then about the process of communication in health education. What do you mean by communication? Communication means the exchange of information between two or more people. It's a two-way process of exchanging or sharing ideas, feelings, and information. It can be cognitive, affective, and psychomotor. So this is about the process of communication in health education. The sender sends the message or transmits the message through some medium or channel to the receiver. This receiver can give the feedback about the message directly to the sender. So the roles of each in the process of communication. Sender, his subject should be clearly defined. His audience, its interest and needs should be well defined. He should have a clear message, a proper channel of communication or a proper transmitting media. He should be aware of his abilities and also about his limitations, both of his own and also of his audience. Next is the receiver, the person who receives the message from the sender. It should be controlled and works on a common interest. Then about the message, the information, it should be in line with the objectives. It should be meaningful. It should be based on the felt needs of the audience. The message should be clear and understandable to everyone. The message should be specific and accurate. The message should be given timely and also on adequate amount. The message should fit to the interest and the level of the audience. The message should be interesting to the listener. The message should be culturally and socially appropriate. Only if the message follows these criteria, it should be acceptable by the receiver. Then about the channels of communication, or I can say the media, the sender uses to send the message to the receiver. Should be interpersonal communication. It can be mass media. Interpersonal communication means a person to person, that is one to one. It can be in a form of lecture, that is one to many. Then mass media involves 1 to 1,000, lakhs, and in crores. Next is about the traditional or folk media, what we have, street plays, dramas, etc. Then feedback. Feedback is the reaction of the audience towards the message sent by the sender. It provides opportunity to modify the message. The sender can modify his message to the receiver as per the feedback he obtained from the receiver. Then about the types of communication: one-way didactic method and two-way Socratic method. One-way communication means in that method or in that type, the receiver or the audience don't have any role. It's a passive method of communication. Knowledge is imposed, learning is authoritative, little audience participation, no feedback, doesn't influence human behavior. The communication, what is happening now, I'm talking to you, it's an example for one-way communication. Two-way communication means Socratic method. Learning is active and democratic, more likely to influence behavior. In this method, interaction happens and the learning is more active when compared to the one-way communication. Then also there is a verbal and non-verbal communication. Verbal means loaded with hidden meanings. It's the traditional method what we use what we do with our mouth. Non-verbal communication is by means of certain actions, facial expressions, etc. So we have this verbal and non-verbal communication. Verbal is a traditional way by word of mouth. Non-verbal involves a whole range of bodily movements and facial expressions like smile, raised eyebrows, and frowning. Then about formal and informal communication. Formal communication follows lines of authority, whereas informal communication is conversing with friends or colleagues. So the communication between you and your teacher comes under the formal, and the communication that happens between yourself comes under the informal. Then there is one more, visual communication, which includes charts, graphs, pictogram, tables, maps, posters, etc. Then also there is communication through telecommunication and various internet modes. Then about the barriers in communication. They can be classified as psychological, physiological, environmental, and cultural. Physiological means difficulty in hearing, seeing, expression, etc. When this should be considered when dealing with special groups, deaf, dumb, or blind. The channels of communication should be selected in such a way that as to target that group effectively. Then is psychological. Psychological means emotional disturbances, neurosis, levels of intelligence, language or comprehension difficulties. Emotional disturbances, depression, neurosis, or any other psychosomatic disorder can cause psychological barriers in communication. Next is environmental. Environmental means the noise, pollution, invisibility, congestion. This can be overcome by making small groups and using appropriate channels of communication. The other one is cultural. cultural communication barrier must take into consideration the cultural factors like patterns of behavior, habits, beliefs, customs, attitudes, religion, etc. This cultural method should be given special consideration when we are interacting with the people in the urban and also the people in the rural area. Their cultural belief, habits, and customs should be taken into account, and then only we can educate them regarding health. Then about the approaches of health education, this is also a very important short essay. There are four basic approaches to health promotion. First one is legal or regulatory or coercive approach. This is the form of approach that makes use of the law to protect the health of the public. The government makes laws and regulations in order to safeguard the health of its people. Example for this type include Epidemic Disease Act, what we have during the COVID-19, Pollution Act, Food Adulteration Act, Environmental Act, the Child Marriage Restraint Act. So this legal or regulatory approach make use of laws to protect the health of the public. Next is service approach. The service approach, this is also known as administrative approach. This form of approach intends to provide all the health facilities to its people with the hope that they will use it. So the health services are provided at the doorsteps, and as per this approach, there is a belief that these people will make use of it. The failure to make use of it largely depends if the health services is not based on the felt needs of the people. Next is health education approach. This form of approach is found to be the most effective means for achievement of changes in health practices and lifestyles of the community. The components of this approach are motivation, communication, and decision making. This result obtained from this approach may be slow, but they are permanent and enduring. Another important factor in this approach is that sufficient time should be allowed for the individual to bring about the desired change in his behavior. So this is a most effective method. Even though it takes much time, the changes bring out by this method is permanent and enduring. Also, it provides a behavioral change among the people with regard to the health beliefs and behavior. Next is the primary healthcare approach. This is an approach that involves full participation and active involvement of the people, starting from the planning stage till the delivery of health services. This is based on the principles of primary healthcare, that is community participation. So this method should involve the participation and active involvement of the people. So the objective of this approach is to make people self-reliant in regarding to their health needs. So the next is about the difference between health education and propaganda. So this table tells you the basic difference between these two. In health education, knowledge and skills are actively acquired in the process. In the case of propaganda, knowledge is instilled in the individual's mind in the process. The next is makes people think for themselves. This is in propaganda, it contains ready-made slogans which prevents thinking in individuals. Next is primitive desires are disciplined in this process. Primitive desires are stimulated and aroused in case of propaganda. The process of health education results in a reflective behavior and makes people to use judgment before acting upon it. In propaganda, the process results in a reflexive behavior and makes people to aim at impulsive actions. In case of health education, the process appeals to reason, whereas in propaganda, the process appeals to emotion. The process helps in developing individuality, personality, and self-expression in case of education, whereas in propaganda, it is exact the opposite. The process develops different patterns of attitudes and behavior according to the medium used. The entire process is behavior centered in education. The entire process is information centered in propaganda. Then moving on to the next important subheading, models of health education. We have medical model, motivational model, and social intervention model. So let's see in detail. Medical model means when an individual, in the medical model, the transfer of knowledge to achieve the behavioral changes. It includes the recognition and treatment of diseases. Also, it requires a technical advancement in case of the transfer of this health information. The model is concerned with the recognition and treatment of diseases and technological advances to facilitate this process. Health information is provided to the people, hoping that they will use this information to improve their health. Next is motivational model. When people did not use the information provided to them, it was felt that just providing information is not at all sufficient. The individual must be motivated to translate the health information into action. The motivational model includes stage of awareness, stage of motivation, and also the stage of action. The last one is social interventional model. However, with the complex public health problems present today, it has become necessary to focus not only on the individual, but also on his social environment, which shapes his behavior and the behavior of the community. An effective health education model should be based on precise knowledge of human ecology and understanding of the interaction between the cultural, biological, physical, and social environment. Then about the contents of health education. What all things, the contents of health education can be categorized into 7 main divisions as follows: human biology, nutrition, hygiene, family healthcare, control of communicable and non-communicable diseases, prevention of accidents, and use of health services. So the human biology, teaching of human biology starts from the kindergarten itself. The children are taught about the parts of the human body and their functions. They are also taught the importance of good health and methods to keep physically fit. Nutrition, the people should be taught about the nutrient value of foodstuffs and the effect of nutrition on health. The main of including nutrition as a content of health education is to help people choose optimum and balanced diet which contain all the necessary nutrients for optimal health. Next is hygiene. It includes personal and environmental hygiene. Personal hygiene includes bathing, clothing, washing hands, and dental care. Should start in the early age of life. Environmental means domestic and the community hygiene. Domestic means with related to his house, and the community means with related to his society. So the domestic hygiene includes fresh air, light, ventilation, hygienic storage of food, disposal of waste, need to avoid pests. Community hygiene includes water supply, disposal of waste, vector control, food sanitation, and housing. Then about the family health care. So we have to strengthen and improve the family health as a unit. It includes maternal and child health care, family planning, immunization, and nutrition. People have to taught about the importance of family health care. main aim here is to strengthen and improve the health of the family as a unit rather than as an individual. This is next is control of communicable and non-communicable diseases. We should provide elementary knowledge about the nature of disease and method of preventing it. So we should encourage people to participate in disease control programs. The aim of it is to provide elementary knowledge, basically. Next is prevention of accidents. Accidents have become a major feature for modern human life. The people have to taught about basic safety rules and how to prevent common accidents which take place in their homes, in their workplaces, or on the road. Next is about the use of health services. We should inform people about the health services available in the locality. It should include screening programs, immunization and family planning programs, etc. They should be encouraged to always participate in the health programs conducted in the community. So once again, I repeat about the contents of health education, human biology, nutrition, hygiene, family health care, control of communicable and non-communicable diseases, prevention of accidents, and use of health services. Then moving on to the very important essay that you asked very frequently for your university exams. That is about the principles of health education. There are basically 12 principles of health education: credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, community leaders, feedback, good human relations. So we'll see in detail about each. Credibility is the degree to which the message is perceived as trustworthy by the receiver. It should be scientifically proven based on facts and should be compatible with the local and social goals. That means the information given by the health educator should be credible. That means should be trustworthy to the listeners or to the people. Next is interest. It should be based on the felt needs of the people. If the health education topic is of interest to the people, they will listen to it. The health educator should identify the felt needs of the people and then prepare a program that they can actively participate to make it successful. So interest means only the if the people are interested to the topic of health education, they will come and actively participate in it. Next is participation. The health educator should encourage people to participate in the programs. Once the people are given a chance to take part in the program, it leads to their acceptance of the program. Certain methods like group discussion, panel discussion provide opportunities for people's participation. Next is motivation. There are basically two motives, primary and secondary motives. Primary means inborn desires food, clothing, and housing. Second motives means created by outside forces. It can be due to a reward or of a fear of a punishment. Praise, reward, love, recognition, punishment, rivalry causes these secondary motives. Next is known to unknown. Before the start of any health education program, the health educator should find out how much the people already know and they give them the new knowledge. The existing knowledge of the people can be used as the basic step upon which new knowledge can be placed. For example, a health education program with the aim of introducing a toothbrush to a rural population will be better appreciated if the communicator starts the program with what are you using to clean your teeth at present, and then going into details like why are you using it, and then connecting it to the toothbrush and then providing details about the toothbrush. So the message should be from the health educator should know very clearly what these people knows and what is unknown to them. Next is setting an example. The health educator should follow what he preaches or what he teaches. He should set an example for other people to follow. Example, a health educator who participates in a program highlighting the ill effects of tobacco should not be seen smoking, since it sends a wrong signal and the seriousness of the situation is lost. Next is human relations. Human relations means the person who is giving the health education to the people should have set good relations with the people in the society. The health educator should have good personal qualities and should be able to maintain friendly relations with the people. The health educator should have a kind and sympathetic attitude towards the people and should always be helpful to them in clarifying their doubts or repeating what is not understood. So the good human relationships means the educator must be an acceptable character to the people in the society. Next is about the feedback. For any program to be successful, it is necessary to collect a feedback to find out its modifications are needed to make the program more effective. So based on the feedback, the health educator can modify his message and makes the program more successful. Next is community leaders. Community leaders can be used to reach the people of the community and to convince them about the need for health education. The leaders can be also used to educate the people as they will have a rapport and will be familiar with the people of the community. The leader will be having an understanding of the needs of the community and advise and guide them. Health education for rural people can be achieved through the head of the village, whereas school children can be approached through the headmaster or school teacher. So then about the practices of health education, the educational materials used, it should be keep the attention of or the focus of the listener, facilitate interpersonal and group discussion. It should reinforce or clarify prior knowledge and behavior. About the audio-visual aids used for the communication purpose. There are auditory aids, visual aids, and combined aids. Auditory means those with the ear. It includes radio, tape recorder, microphones, amplifiers, and earphones. All the above mentioned auditory aids are useful in reproducing any kind of words spoken and also helps in repeating the same. Apart from being used as a teaching aid, they can be used for entertainment and mass communication. Then next is the visual aids are based on the principles of projection. Visualization helps in individuals to understand better. Next is about the these visual aids can be classified into projected aids and non-projected aids. Projected aids means films or cinemas, film strips, slides, overhead projectors, transparencies, bioscopes, video cassettes, and silent film. So that means that requires projection. Next is non-projected, means blackboard, picture cartoons, photographs, charts, posters, flip charts, flashcards, flannel boards, models, and specimens. There is a combined both combination of audio visual aids we have, that is television, tape and slide combinations, sound films, multimedia computers, motion pictures or cinemas, video cassette players, and recorders. There also include the traditional media such as folk dances, folk songs, puppet shows, and dramas. Then moving on to the other important topic, methods of health education. There are basically individual approach that is directed to one person, group approach that is directed to a group, and the other one is mass approach, which is directed to a mass amount of population. So the individual approach can also be used for public health personnel, since they will be visiting homes and can interact with the individual and their families. So we'll see in each in detail. The first is individual approach. When it can happen when on the individual's visits to an health center. For example, a patient visiting your dental clinic, you can educate that person, and it is considered as an individual approach or one-to-one approach. The advantages are they can discuss, argue, and persuade the individual. Specific interest can also be discussed. The disadvantage is only a small number can benefit. Health education is given only to those who come in contact with the dental surgeon or with the public health personnel. Next is group approach. We have various methods for the group and group approach. The method what is happening now that I'm talking to you comes under the category group approach. That means Dr. Ansil is taking lecture for part 1 students. We have different methods under this group approach: talk and talk, symposium, group discussion, panel discussion, workshop, conference, role playing, demonstration, etc. So let's see each in detail. Talk and talk is a traditional method, carefully prepared oral presentation of facts, organized thoughts and idea by a qualified person. The group should not exceed 30 members, and the time should not exceed 50 to 20 minutes. Next is flip charts. The ideal size is 25 to 30 centimeters based on chart and should be brief, help to hold the attention of the group to a larger extent. Flannel graph maintain the continuity of the education topic. It's a very cheap medium. It is very easy to transport. This can be used for dental camps and other public health programs. It promotes thoughts and also the criticism. Exhibits. For example, for some in different exhibitions, you may have seen objects, models, and specimens. That is, and also a method of group health education. Next is films and charts. So the lecture is also an example for this group discussion, but it has got certain disadvantages also. There is minimum involvement of audience. Learning is passive, does not stimulate thinking or problem solving capacity. Comprehension varies with audience. Behavior not necessarily affected. Next is some of these methods of group approach: demonstration, group discussion. That is a group of 6 or a group of not more than not less than 6 and not more than 12 members. There should be a moderator for the group. The basic rule is that do not interrupt when other member is expressing his ideas, and makes only relevant remarks. All the members should accept the criticisms raised by the other members very gracefully, and at the end they should reach into a conclusion. The advantages and disadvantages of a group discussion is advantages means a decision is accepted easily. Limitation means there are many limitations, means it is very difficult to reach into a conclusion in case of a group discussion. Next is a panel discussion, means a panel of 4 to 8 experts sit and discuss a topic in front of an audience, headed by a chairman who opens the session, introduces the speakers, and keeps the discussion going. Audience are allowed to ask questions. Chairman sums up the different views presented. So these are the few panel discussions pictures. Next is about this symposium. Symposium means a series of speeches on a selected topic. Each speaker presents a brief aspect of the topic. There is no discussion among speakers. In the end, the audience may ask questions. The chairman makes a summary at the end of the session. That is symposium. There is only slight difference between this all these methods. Next is workshop. It consists of a series of meetings with emphasis on individual work with the help of resource person. The total workshop is divided into small groups, and each group will select a chairman and a recorder. The individual work solve a part of the problem, contribute to a group discussion, and leave the workshop with a plan of action for the problem. Then next is role playing and socio drama. The size of the group should be about 25. The situation is dramatized to make communication more effective. It is followed by a discussion of the problem. Puppet shows used in villages is a type of social drama useful for children's. Basically, the children's health education, it is very effective. Next is the third approach, mass approach. Health education for a large community or the general public can be given using the mass media of communication. It came into role after 1920, after the discovery of printing machines. It reaches remote places and also to a large number of people. Mass communication literally means communication that is given to a community where the people gathered together do not belong to one particular group, but it is not effective in changing the human behavior. And most of the mass approach involves only one-way communication. These are few examples for mass approach: television, radio, internet, newspaper, printed materials, and emails. So these are the examples of mass media. Also the posters, billboards, and signs, health museum and exhibition, and also the folk media. So let's rewind about the different subjects, topics what we discussed today. We discussed about the definition of health education, types of communication, then approaches of health education, models of health education, principles of health education, types of communication, then also very importantly methods of health education. So the remaining session we will continue in the next theory class, and thank you for the your patient listening.